Unlearning Unlimited. What? Unlearning Unlimited. Yeah. Hey.
Hello, welcome to Unlearn Unlimited podcast. Super excited. Today our topic is around ADHD, real or manufactured. That's what the real word is, real or manufactured. I'm super excited because I have a good brother here that I know who does really great stuff. Dr. Tony Johnson is in the house, Tatiana.
Love that. Welcome, Dr. Johnson.
Yeah, so as you guys know, my name is Dr. Cito Narcisse, your host, and our co-host here is...
This is Tatiana Echevarria.
Yeah, we're super excited about hosting this podcast. As you know, we've had the last couple of episodes, really cool and great things have been going on, and talking about topics around education and culture. You know, when we started to think about this podcast, we said, hey, we wanted anything around education and culture that clashes and talks about what society and what we're really doing is really important. We always try to get guests that are unfiltered, who are also innovative, leading the work, not only about things that they talk about in terms of like, you know, what they think that they shouldn't have learned, even though they've learned it anyway to get where they are, but what are the unlimited possibilities? And so innovators that are in that space, we're always excited about bringing on board. And so today we got Dr. Tony Johnson, who's here. And just to give you some context, Dr. Tony Johnson is a medical doctor. He is the medical doctor at Southern University out in Baton Rouge, Louisiana, and also the sports medicine, one of the sports medicine doctors for the LSU athletics team. So he does, you know, LSU athletics, whether it's, you know, basketball or whatever sports there is and those things. But I'm gonna let him go into that part. And also super excited about, you know, when you get to talk to high achievers, doing really great things. We always want to do that. So, and he's young too. I don't know if you see it, Tatiana. He's young.
I see it.
Young with excellence. So we're gonna get to all that. Dr. Johnson, welcome to the show.
Man, I'm so thankful for y'all having me. It's a pleasure to be here. Cito is a good brother of mine. You know, when you shouted out, I would, you know, for sure wouldn't be any other place right now.
Yeah, well, we're just grateful you taking the time to come and talk to us, and also, you know, bringing expertise. I mean, Dr. Johnson, I know you're not the only doctor in the house. In your house, you have it's actually two doctors. Right. Is that correct?
That's right.
So you and your wife are both doctors, and what's her field, her expertise?
So she's a pediatrician by trade.
Okay.
She trained at Bahari University for medical school. She's an LSU graduate.
Yeah.
Now she practices full scope pediatrics.
Right, and you guys have been mostly in all of the contexts in terms of helping people, whether it's in family medicine, whether it's how they think about sports medicine, and a lot of different spaces on maintaining health. Is that correct? For sure.
So I am family medicine is where I did my training in. I did a fellowship in sports medicine, and so now. The cool part about family medicine is it kind of leaves you wide open to do a little bit of everything. So right now I also work in the ER while also doing work with the sports team. So I kind of have a balance. I initially started with my own practice and then kind of transitioned out of that to be more open, to be able to spend more time with the family, but then also focus more on sports.
Yeah, and so just super excited. So I'm not, you know, we always get into this space, Dr. Johnson, where we don't like to always read the bios. You know, we always tell people, you know, instead of us telling people about, you know, for us to tell people about who you are, we want you to tell us, you know, what are the things that people don't know about you? And, you know, you are a success, I would agree, right?
Yes.
And you've done well in the country and doing a lot of different things with your education and all that. And so, like, you know, tell us a little bit about yourself. What do people not know about the Dr. Johnson world?
So originally born and raised in Indianapolis, Indiana.
Okay.
Naptown, that's my home. Public school kid, graduate of Arlington High School. So went to an inner city school, know about the come up from there all the way through. That's one of the things I think about my journey in particular was kind of being told, you know, from the beginning, hey, like, the school you're going to, you shouldn't do the things that you do now, you know? So going to a public school, then going to an HBCU and graduating from an HBCU, definitely was told I wasn't going to go to medical school if I would have went to an HBCU. Then, of course, I chose to continue the non-familiar path and went to school in the Caribbean. Um, the island of Antigua is my second home. American University of Antigua is where I went to medical school.
Nice.
And then from there, did my training in Atlanta and Chicago, and then went to residency at University of Alabama, where I was the chief resident.
Okay.
Went from there to Baton Rouge, and have not left Baton Rouge since. So that's kind of the ins and outs. I think that for me, leadership and mentorship are things that are very important to me. I feel like you can't be what you can't see.
That's right.
And I think in the realm of education, that's one of the big things that we see as a problem is just there's not enough of us reaching back and mentoring those that have interest in our prospective fields. So I think that that's very important. That's one of the things I take pride in. Love my family man. Summertime is now, so we're doing a lot of traveling and spending time together. So that's kind of the ins and outs.
Well, you know what's interesting to me, before we get into the whole, ADHD topic, I wanted to we hear this all the time, right? When you look at minorities or kids who come from poverty or whatever their background is, where they got these big dreams and people start telling them, like, you can't do this or you can't do that, or in their environments that are not only their own environments doesn't see sometimes that dream, but like when they're engaging with people, they're telling them what they can't do, right? And then when they achieve, everybody makes it like, oh my gosh, they made
It's
it.
a huge deal.
Like, I've been looking at people like, come on, like, what if we started off by saying you can make it, and then we just kept it all positive, the narrative, right? How much achievement would really happen, right?
Yeah, definitely. I think a lot of it is fear, though. I think that a lot of us minorities are working day to day with imposter syndrome, whether it be our parents that are working with that or us, as, the children or the second generation working through that. And I think that that's one of the things, because realistically, you put it in perspective, no parent wants to see their kid fail, right? And no parent really wants to see their kid have all their hopes and dreams up high and then get let down. So it's kind of like, I want to support you, but I don't want, to blind you, in your ambitions in a sense. And I think that that's one of the things that happens. But I agree. I think it definitely need more of, just positivity and, pursuing. And again, reaching back is one of the biggest things.
That's such a great point. I think going back to what you stated about just fear, I would co-sign that, because I think our parents sometimes make choices or make decisions based on their own fears and either push us in one direction or push us in another direction. And oftentimes it is tied to fear, but we don't just see that from necessarily our parents. I think you also see that manifest sometimes in the educators you come across in schooling, and maybe some of their own limited potential somehow becomes your own, whether that's intentional or not. So I think that's a great point that you bring up.
Well, I'm
Definitely.
Okay.
Oh, no, I was just going to say, in college in particular, I was a basketball player, I played basketball. And I remember, this wasn't at Wiley, this was at a PWI that I went to prior to Wiley. But it was like a computer science teacher or something, and was like, yeah, I don't know about you being a doctor. I think that's quite ambitious and stuff like that. I'm like, you teach computer science? Like, that's not, like, how are you going to be the one to guide me on this? So, so I think it's multifactorial, and which makes it very challenging. I think the will, though, and I think that that's what we can't forget. I think the will and the passion is there. It's just directing it to the right place and allowing those young minds to get there.
Absolutely.
Did you get to see that computer science teacher again?
I know.
No, I have not. I've actually not set foot on that campus since I left.
It would be one really good thank you card to send.
Or some flowers.
I'm really excited for us to start talking about some ADHD stuff as a former educator. And seeing very often and through the years, the massive increase of students being diagnosed with ADHD and predominantly boys. So we have some questions for you to start talking about ADHD. I'm really curious. Let's do it.
Well, let me, I got a little cheat sheet here because, me and Tatiana has been doing our homework, on these topics.
Uh-oh.
But so let's talk some some whole numbers, right? So a couple of things that we found out was one is said the prevalence of ADHD diagnosis has been a notable increase. And it has really gone really huge, specifically in particular communities. And also it has become a very controversial thing because, depending on where you are in the educational system and what you're doing, people think it's either real or not real, and they go through all this processes. And from your perspective, as a medical doctor, what do you think about that? And is ADHD real? Let's just talk about that first, right? Let's just get that out the way.
So first things first, yes, it's real. It's very real. It's a serious condition. It's a chronic condition. It's labeled typically in 3 categories: hyperactivity, impulsivity, or it's a combined type of both. Impulsiveness basically means can't control sometimes your thoughts and actions, so you just do things. You may have a kid that typically does well, but they get some quiet time, or it's quiet time in class, or they finish their work early. The next thing you know, they are getting in trouble in some way, shape, or form. Hyperactivity is the always doing something. Can't really, sit still. Typically, it's hard to keep them on task in a sense. But I preface all that to say, yes, ADHD is real, but there are also a lot of things that mask as ADHD or get diagnosed as ADHD, which may not be ADHD. For example, if you have, a 5-year-old that is an active learner and learns better with hands-on activities, and they're in an environment that's structured for them to sit still and, kind of ingest in a different form of learning, that's difficult for the child. And it's easy for that child to be confused as someone that has ADHD. So I think that, we definitely in the medical field still have a lot of work as far as screening tools. Right now we use a Vanderbilt, which basically is a double-sided. So you are, as a parent, typically you are answering these questions about your child in the home environment. And then the teacher also answers those same questions. And that kind of helps come up with the ADHD diagnosis. Again, right now there's no blood test or, imaging that we can do to determine that, if a child has ADHD. So it is very difficult still, and we're still kind of working through it in the medical field to try to get better at ADHD and who has it, who doesn't have it, and even treatment-wise, we're still got a long way to go.
So let's talk about our controversial first data point, right?
Yeah.
So in schools, there's research that shows that white and non-Hispanic students are diagnosed more with ADHD than Black or Hispanic students, right? And usually for Black and brown kids, it's more around they're just behavior problems or something like that. But for white students, they can show the number is much. White and non-Hispanic students, it's much more. They're diagnosed with this ADHD. What do you think about that? And is that a trend you're seeing, or do you think there's some cultural context? Like, what's the bias in that space from your perspective?
So I don't think it's a trend. I think that's a fact. I think that studies have shown so far that Caucasian students are typically diagnosed with some form of neurodivergence, ADHD being one of the most common, compared to Black and brown students being diagnosed with being just bad behavior or oppositional defiant, or kind of those categories. I think it's a double-edged sword, because I think one of the things is resources. You also got to take into account that a lot of the schools that are more populated by Black and brown students are lacking a lot of resources. Even with the Vanderbilt testing, right? That puts it on the parent and the teacher to completely fill out this form. That form get back to a physician of some sort to lead to a diagnosis. If a student doesn't have transportation, a mom who's working 3 or 4 jobs, it can easily be one of those situations that a child is never really diagnosed properly because of the situations in the home. So I think that those are all factors that play a significant role. in the number difference.
Now, I now wanted to piggyback on that one with just kind of our experiences working with students that are in Black and Brown communities.
For sure.
They may not necessarily be diagnosed as having neurodivergence like ADHD, but then we do see them diagnosed with a specific learning disability or oppositional defiance or emotional behavior disability.
Yep.
When I wonder if it could just be ADHD, but we see them being diagnosed with several other potential neurodivergence. So that I think is really interesting. And I wanted to get a little bit more controversial because I was scrolling Instagram and there was a doctor that was being interviewed. I think his name is Dr. Amen. And he brought up ADHD being genetic. What are your thoughts on that at all?
So again, I think it's multifactorial. I think there is a genetic disposition for sure.
Okay.
So there have been studies to show that, a person who has family members that have ADHD are more likely to have it than somebody who has zero family members that have ADHD.
Interesting.
But that's not necessarily the only thing. Environment exposure, things like lead have shown to have increased causative factor for ADHD as well. So I think we can't just put the hat on a particular thing. I think that the more important thing is trying to open our eyes and seeing, one, that we have a problem. When you look at it compared to some of the other countries, China, Japan, like your Asian countries, even in Europe, we are like, way high as far as our diagnosis of ADHD compared to those countries, which makes you wonder, like, why is that?
That
Yeah,
is
'cause
my curiosity. What is that?
Yeah, because they have way more population size bigger than
Yes.
us, right?
Yeah.
Population size tends to be bigger, especially in places like India and Japan, for example. Is it exposure? Is it, environment, or is it just, in some of these cases, is it overdiagnosis? That's another side of it that, I think people don't really talk about, is the pharmaceutical side. I mean, you have big companies that produce medicine, and this medicine, it helps calm a child down in a sense. For a child who has ADHD, this is a treatment for them. For a child who doesn't have ADHD, it also can, cause them to be more calm, and kind of less hyperactive in a sense. So I think that that's something to, kind of think about as far as, again, we're still learning, we're still trying to figure this thing out, but I think that that's one of the things that, is there.
Can we go back to there's a comment you made, you said that there was a lack of resources that are needed in particular communities on why these things are happening. What would you say are the resources that are needed? And the reason I bring this up is that, we always talk about I'm going to also ask you about what's the unlearned portion of this, right? That people should unlearn, because, people learn when a lot of different things, it doesn't apply to the real world, and then what's unlimited in terms of what's the possibilities in terms of what they can do. So, but what are the resources you'd say in particular communities that need to be there for either one, to decrease that diagnosis, right? Or get support if you have that in a particular way?
So I think that, it's a couple of things. One of the things that you're seeing right now is you look at early onset learning, like, our programs are starting to be cut, which I think is something important, getting kids in early and getting diagnosis. Typically, ADHD is diagnosed at younger age. There is a such thing as adult onset ADHD, but majority of ADHD is diagnosed typically before the age of 7. So, if you don't have, things like, early, like I said, early pre-K, kindergarten, where kids are getting seen and education to be able to see what they can do and they can't do, what their style of learning is, I think that is a limitation. I think that you got to also look at the basic barriers, right? Transportation, programs that the school has dedicated to kids with special needs, teacher to student ratios in classrooms. And then along with that, I think the other thing that is important is really taking a look at basically time parents spend with the children. Again, it's different. If you have an affluent mother who only has time to help educate after her kids gets out of school, then it's easier for them to spend time and to be able to even come up with that diagnosis. Because they see their kid every single day. I mean, we have, in a community that doesn't have a lot, you may have a mom that's working 3 or 4 jobs. The kid is living with the grandma, and it's just, hey, we're just trying to do what we can do to get by. So we can't even really divulge deep into what's going on in class. Did he get in trouble today or not? He didn't get in trouble. Oh, we good. You know what I mean? And that's it.
Right,
And,
right.
there may be something that's missing in that.
So the unlearned portion of that would be what?
I would say from a medical perspective, time spent making appointments with your pediatrician and getting into the doctor. I think that that's something that is one of the things I think it's taken for granted. I think it's, oh, well, go to this doctor, you do a physical and that's it. But that doctor being able to lay eyes on that child and say, okay, well, this is different. Oh, this is his milestones or her milestones and where they should be at age 4. And these are the ones that we're missing. And I think that, one of the things is that we're seeing is follow up and, loss to follow up. And so I think that that plays a role. So I think that that's one of the things I would say is unlearned.
So let's push the envelope a little. Is that good? What you talking about?
Let's do it.
All right.
Well, I want to go into a little bit. You talked about later onset for adults, that this is also a possibility, even though in most cases we see the behaviors manifest themselves earlier on, children who are up to 7, which that's new to me. I did not know that either. So if we consider the statistic that 25% of adults suspect they have undiagnosed ADHD. And I'm also curious about where that comes from, either like, is that a number pre-COVID, post-COVID, as we spent a lot of time at home and we're trying to figure out what's doing our time.
Listen, I felt ADHD at home, man.
So I wonder about that. But yet only a fraction, seek formal evaluation. What does this say about the accessibility of the diagnosis, the stigma that's associated with it, or even perhaps, self-diagnosis, which we feel from sometimes, us people that think WebMD has all the answers, So yeah, what are your, what are your thoughts there?
Well, I think it's a difficult topic. The reason why I say it's a difficult topic is because I think a lot of people confuse ADHD with lack of focus, when in fact it's a little bit more than just lack of focus. It's lack of focus in a sense that it starts to affect your lives in negative ways. Can't hold a job because your attention span can't, stay in the same place long enough, and you've been fired multiple times. That person is in a sense more likely to have the ADHD than, the person who has not been diagnosed and has held a job for 30 years and not had any issues and, but just sometimes gets tired and, so I think it's difficult because anytime we're not locked in, you can say, oh, well, I might have ADHD. And that there is a human part of that where, you won't always be locked in. Sometimes you are distracted. And again, it's not a diagnosis. You just are distracted. So I think that that's something to kind of keep in mind. I do think that as far as testing and things goes, there is a test that psychologists/psychiatrists do in adulthood that can diagnose ADHD. But again, accessibility is very difficult, and got to have insurance and all the things. And I think that that's one of the things that prevents people from going in to be seen.
Now, can I inquire a little bit more? Is it similar to the Vanderbilt? I filled out several of those as a classroom teacher. So is it similar for adults?
A little bit different.
Okay.
So there are different scale tests that you use, but like official testing, I want to say is an actual formalized test. So this isn't necessarily comparing, work and home life. It's a little bit deeper than that. So
You know what's interesting? I was just thinking about when you talked about the factors that impact ADHD. There's some now with technology and all these things, becoming more and more part of people's lives. Now you hear theories like, screen time can affect that. The type of food you eat can affect that. I mean, like, people are going
red
like,
dye,
yeah,
whatever
red dye.
number
Like,
it
they're going
is. Yeah.
all over the place now about it. And so, like, how are you guys in the medical profession kind of like managing human understanding in this space?
So again, I think, in the realm of ADHD and misdiagnosis of ADHD, that's one of the things that I think can lead to it. For example, excessive screen time. I mean, you go to a restaurant now, family restaurant, you'll see, a 8-month-old with a tablet right in front of them, which is very different than how we grew up,
Yeah,
right?
that's right.
And I think that, we got to be careful as parents, and even educators, because our kids are now growing up always being stimulated by something, right? And me and my daughter argue about it all the time. It's just like, hey, she's like, I'm bored. I need something to do. I'm like, no, you don't. Like, just chilling and relaxing is
It's
actually a
okay
good
to be
thing.
bored.
And when you get older, you're gonna appreciate just doing nothing.
Yes.
So,
Kids today is all entertainment. So
yeah, it's almost like a fixation where it's just like, all right, my brain is too quiet. I need something. So I'm gonna start making noise, or I'm gonna start, you know, touching something or running around or doing something just to, kind of keep myself busy because I'm so used to, having this screen in front of me. And I think that again, when you come to misdiagnosis of ADHD, it's easy to have a kid that has always had a tablet in front of them from 0 to 5 and has known nothing other than I'm eating in front of this tablet. When I get done eating, I go up to my room and I'm in front of this tablet. And it's just like, okay, does this kid actually have ADHD, or is it that they're tablet dependent because that's, kind of been their pacifier? Because, realistically, as parents, we're working, we're tired, and that tablet, even for me, myself, there's been times where I've been like, hey, babe, go ahead and, have at it for a little bit. And, she gets quiet, she watches something or does something, and, I get to do what I need to do, basically. So I think that you have to, moderation is key. Medicine is very big on moderation. And I think that that's one of the things to remember is that everything is good in moderation. There is a such thing as too much screen time, just as much as there's a thing as too much McDonald's, right? You got to limit the things because over time that becomes habitual and you can become dependent. And it may not even be a diagnosis of ADHD at all.
Now, I want to dig a little deeper as we talk about like unconventional, beliefs and how someone may get ADHD or even treatment itself. I know what I came across a lot as an educator, and I think you probably saw this too. We had a lot of parents that went into, I don't want to medicate my child. I do not want to give them XYZ, whatever that may be, to treat. What are your thoughts on that specific belief, or even some more non-conventional treatments? I kid you not, I recall a parent that gave a child Mountain Dew before they started the school day and thought that was something to mitigate the ADHD, which I was still don't know whether that worked or not. But what are your kind of, what does that look like? And what do you also hear, with your work?
So to answer your questions, one, I would say, we got to be careful. Be careful, be careful. Misinformation is at an all-time high. And realistically, you can go on YouTube or whatever your social media of choice is and find a rabbit hole for whatever you're trying to get into. And, so just be careful. Realistically, we have seen people lose their lives because they believe something that they see that does not have any kind of clinical backing, any kind of educational backing. There are no studies behind it. And, you see people doing these things. And I know that, there are mistrust in medicine. You have the thing called big pharma that everybody is very, very skeptical about as well. Even us physicians sometimes are. But at the same time, I think that you have to be really careful about the information that you're ingesting in regards to that. Um, Remind me of the first question you asked, because I did want to get into that.
No, yeah. Basically, just unconventional forms of treatment versus unconventional forms of treatment. What
Yeah.
do we need to? And I think you hit on maybe some potential unlearning there is, everything that we see that is public and that is able for us to be viewed doesn't mean that we need to take that on and
Sure.
take it as
So that's
truth.
that's what I wanted to say. So you had mentioned, a parent that wanted to go without medication. I think that a trial of that, I don't have a problem with that. I think that that's one of the big misconceptions about doctors is that we want you on these medications. No, that's not true. If things can be regulated without medication, I can't speak for everybody, but the way I practice, if we can find a way to treat you 100% natural, sure. Just like blood pressure, right? If you say, hey, doc, I don't want to go on blood pressure medicine, I'm going to change my diet, I'm going to drink more water, I'm going to start exercising more, and that blood pressure comes down, not itching to give you medicine. And I think it's the same in ADHD. I think it all is case and case dependent. It depends on how severe the ADHD is, of course.
Yes.
But then you don't want to see your child struggle, but at the same time, there are people who are managing their ADHD without medications. So I think that that is possible. But I want, again, be careful and I don't want us to get in the place of ignoring a child with a problem.
Yes.
And, I think that that's what you have to worry about sometimes in those cases is, stubbornness, whether it be cultural or just in general acceptance of a diagnosis to say, oh, well, no, my kid ain't never going to go on medicine.
Yeah.
Well, it just really depends on how the kid is doing, how they're doing in school, how are they doing at home, are they participating in any extracurricular activities, how do they do there, how do they interact with people? All those things make, importance as far as treatment and whether or not they need further treatment.
So let's shift a little bit. I want to get into I know a space that you love a lot in the sports medicine world.
Sure.
I remember when I was superintendent, the LSU teams, and you guys did a whole lot of stuff to support kids. I mean, I remember when the Angel Reese Foundation came and gave kids books and did a lot of community stuff. Shout out to Angel Reese and their people.
Shout out to Angel.
And also like a lot of stuff. What I wanted to ask you is you treat a lot of you're treating folks at the college level, folks who have become professionals, right? And since you have been in that space, how people don't always know. They see these athletes are top performers because they gotta do these sports. Well, how have you seen ADHD impacted them in different set of ways and how to help them keep focused in terms of their high performance and what they're doing? What has been the ways that you have seen that?
For sure. I think it's all the things that we've been talking about so far on the podcast. I think that we see a lot of undiagnosis where kids aren't even being diagnosed until they get to college. Some of that could be, again, some of those difficulties that we talked about before. But then also because, as a star athlete, you are, in a sense, protected and catered to get to that next level. So I think that some of that is there. I think that, college is the next level in education, so it challenges you. And so sometimes you really don't know until you're really challenged. And that's something else that is there as well. So I think our goal is to do the best that we can to help any athlete, whether it be high school, college, or above. But I think it's one of those things that you want to make sure that, especially in an athlete or a kid that has difficulty with classes and things, just making sure that that's not a stone that hasn't been left unturned. Because, if that's the case, then that can, definitely be, a make or break factor, not only for them doing well in college, but can also get into the next level.
Have
Go ahead. No,
have you seen that pattern in some sports versus others, some gender versus others, or is it all over the place?
No, it's kind of all over. It just depends. Again, you're talking about, like you said earlier, ADHD, is around less than 20% of the population. So it's still a small amount, but at the same time, it's there. And again, I think that, there are so many factors as far as treatment goes, right? Because like we talked about before, culturally, accepting a diagnosis, knowledge of self and saying, hey, man, I'm not doing well. I need, maybe more medicine, or maybe this is too much medicine. I think that those are all topics as well. And getting people more comfortable with talking about kind of how they're doing, how they're feeling, and how, their condition is affecting them. So I think that those all play a factor.
Now, you have a sports background, right? And you're working in sports medicine and you see all these athletes. Now, I'm all of 5 feet tall, so that's just, obviously not my area of expertise
Hey,
per
listen,
se.
gymnastics.
Right.
That's right. I mean, in my head, I'm the next Simone Biles, right? But so as you work with athletes, right, we've talked about conventional treatments, we've talked about, possible medication and things of that nature, but also whether you are or you aren't an athlete, what are some lifestyle adjustments or some ways that you work with your own athletes, or maybe your daughter, or just anyone, that you would say, hey, beyond medication, non-pharmaceutical treatment, obviously if you need that, great. But what are some other ways that people can kind of help and support in managing their whether it's hyperactivity or their impulsivity, or even if it's lack of focus that isn't ADHD?
For sure. I would think that one of the big things is the utilization of behavioral health. I think behavioral health is one of those things that has a huge stigma, especially in our community.
Yes.
And, I tell patients all the time, I tell my athletes all the time, me and my wife, we sit down with a therapist every 2 weeks. Things are great, so y'all know. But
Right,
that's
right,
a stereotype that's there, right? But I think it's great to sit down with an unbiased source to be able to talk about things, or talk through things, or talk through big decisions. In today's time, especially now with social media, we live with a lot of stress. There's a lot more pressure, and especially in the sports world, when you talk about athletes, but even our children, and pressure to perform, pressure to, fit in at school, and those things. And so, that's one of the things I think can be highly beneficial, is being able to talk to somebody. It's one thing to talk to your parents, or, talk to a friend, but again, to talk to somebody who doesn't really know you, or have a preconceived notion of who you are, that I think is very beneficial, because it allows you to be more open, and it becomes a trusted source for you to kind of talk through things.
I would totally high five you right now if I could, but I'll just give you a virtual one. We don't talk enough about the value of, I call it maintenance care. When we talk about, you were just talking about, you and your wife and going every 2 weeks, and it doesn't have to be because there's a fire going on in the background and that's why we need to go.
Wait, are you saying there are fires that don't go on, or are you?
I mean, hey, to each his own, right? We're gonna say it's not that, but I do think it's valuable to say, talking to an unbiased third party that probably knows nothing about you, that is, completely neutral in their understanding of what your struggles have been previously, currently, whatever. I think that is something we don't, and like you said, in our communities, I do believe it's getting better. I am hopeful in that, and continuing to charge on with that belief that behavioral health is.
Yeah, and I think the other part of that is consistency is key too, and that's something that we didn't really talk about yet in the realm of ADHD, and just young learners, is consistency.
Yeah.
And having the same teachers, or the same coaches, and the same personnel in your corner. I think that right now we're unfortunately in a difficult time where there's so much shift going on. You have, Mr. Jones, who was your favorite gymnastics teacher, or not gymnastics, gym teacher. And then, next thing you know, boom, next year he's not there anymore. Nobody knows what happened to Mr. Jones.
Yeah.
Even though you created that great relationship, and, you couldn't wait to be in his gym class, or the fifth grade teacher, or, so I think that that's one of the big things that is important, especially in the behavioral health tip, is just having somebody that knows you and gets to know you, and that it's not a new interaction every time. I will also go on to say that it's not one size fit all. You got to find the person that is for you. You know what I mean? And I think that sometimes culturally that gets us, because I know, we want a Black provider. We want, it may not be a Black provider that you gel with, the best,
Right, right.
For Cito, it may be a 50-year-old Chinese woman, and he just feels like I can pour out my heart and soul in these sessions and she gets me. You know what I mean? It just may be that.
Well, I need a lot of
I
therapy.
think, but I think that, that's one of the things is that, I think we got to let go of the preconceived notion that, okay, I got to do what everybody else is doing, or this person did that, so I think it's going to work for me. I think you got to really, look inside and try to find what works for you, especially with somebody that you can get comfortable with, opening up with, especially, again, treating ADHD with or without medicine, but also having that behavioral health component.
So let's. I want to just tap a little bit into the consistency piece. So this portion we always talk about is we call our unlimited, right? So we get to a space where okay, now we talked about all the different stuff. I got paper falling here, all the different stuff that's going on. But now let's talk about like solutions and possibilities and those things. And so when you talked about consistency, if we're thinking about, you had to advise various people in the community about here's the top 3 to 4 things that need to be consistent around keeping your focus, whether you have ADHD or not. Like these are the things I would say from a medical perspective you should really be on point about. What would those be?
I would say in the realm of ADHD is having a behavioral health counterpart that is helping you manage your condition. I think that that's very important. I think having a primary care also is very important. Those two, I think right now, unfortunately, we can fall into the trap of going to urgent cares for our primary care needs or emergency rooms even. And realistically, again, that's cool if there is an emergency, but you don't really develop a relationship. And typically it's a different person that sees you every time. So I think that a lot of medicine, or one of the most underrated parts of medicine is the continuity of care, and being able to see somebody, for the past 5 years. So I know you, I know who you are. I know, what you've dealt with. I know I've seen you up and happy. I've seen you down. And I think that helps as far as a medical professional goes, being able to, diagnose, but also being able to give the right treatment as far as things go. For example, like with ADHD, you may get started on a medication dose, and some people are just stuck on that dose because they don't see the same person regularly. And so you kind of hop around and just get refills, but then who's assessing this dosage that you're getting? Are you, better? Is it too much? Because sometimes it can be too much. So those things are important in as far as the overall treatment. So I would say those 2 things. I would say finally, just creating a network of people in your corner, that, whether you're a parent that has a smaller child with ADHD or an adult with ADHD, having people that you can rely on, that you can kind of discuss things with and that you can talk to and kind of help redirect you at times.
That's awesome. Now, in that same space of what are 3 things to consider, now if you could wave a magic wand and say this one thing or 2 things are what I would like to address and maybe change how society perceives ADHD. Like what would you wave like your magic wand and say, I would like us to stop thinking these things regarding ADHD?
Well, I think one would be trying to diagnose without any kind of healthcare professional.
I feel attacked a little bit because I'm a doctor via WebMD.
You're talking to the WebMD queen on here, man. Like every time it's like a diagnosis.
There's nothing wrong with going to seek help. If you feel you have that diagnosis, go and officially get that diagnosis so you can be treated the right way. I mean, there's so many topics that we didn't even dive into. Like, for example, the people that have self-diagnosed and are getting medicine from in a way that may not be, prescribed by them, taking somebody else's medication or giving, the other child medication because one of your children is diagnosed and one of your children isn't. I mean, there's so much of, those kind of things that are happening when realistically, if you have concerns, I think it's important to seek health care. Now, again, I know that's difficult at times because of many barriers and factors, transportation and financial costs and things like that. But I think we have to make it a priority if we think that there is an issue there. I don't want us, again, to fall in the trap of, self-diagnosis, whether it be us or our kids, and then self-treatment, whether that be with somebody else's medication or a remedy that was found online. I think that, you want to be safe and careful and make sure that you are taking every step to see it all the way through as far as, getting the medical diagnosis and getting the help that is needed.
Well, we come to the end of the show, so
Okay.
wanted to just wanted you to share any final thoughts you had, and anything else that you can always tell our guests to highlight something that they feel like there's coming or anything that you want the audience to know, and then we can wrap it up from there.
No, final thoughts. I would just say ADHD is real. It is a real condition, but make sure we're doing all the right things to receive treatment, whether that be medical, non-medical, behavioral, or whatever else that may be. I would also say final thought is let's not rush to the diagnosis of ADHD. Sometimes it could be the tablet. Sometimes it can be just you have a kid that is kind of like a greyhound that just wants to be outside, wants to play, wants to be active. You know what I mean? And I think that finding those things that better fit your child instead of just running to the diagnosis of ADHD is important. But all that to say, if there are concerns that are growing, the sooner the better. Seek help with a medical professional. And, I think that that's important. Other than that, I appreciate y'all having me. It's been a blast. I'm here for y'all. Let me know if y'all want to dive into anything else.
We will
Hopefully
be
I can get my
calling.
wife.
Yeah. We're gonna get your wife
Hopefully I
on. We
get my
gotta get her on.
wife
Yeah.
on, or us on together, and we can kind of chop it up. It gets heated sometimes when we go back and forth. But no,
That
follow us.
sounds
And you can
normal.
think of us as a therapy. That 2 week there, we'll just be that we'll take the place of the therapist on
There
that
we go.
time.
There we go. Hey, as long as
well,
it's free. If it's
we will
free,
interview-
you might be working with something.
Right.
We'll do the podcast the week that you guys don't go to therapy. We're like an in between.
Yeah, there you go. There you go.
So
But yeah, follow us at the Dr. Johnson. Me and my wife have an Instagram page, and it's all positive.
yeah, shout out the Instagram page, Doc.
The Dr. Johnson.
Doctors Johnson.
So,
All right.
Yep.
Well,
Again, appreciate you having me, man.
yeah, listen,
a joy.
we appreciate you taking the time to come to the Unlearn Unlimited podcast. That's Dr. Tony Johnson, ADHD real or manufactured. You heard it directly from one of the top physicians in the country that talks about this work. When we have health issues and those things, we're going to be bringing you and your wife back to, we always say, instead of reading books or listening to, multiple voices on narratives, we want to talk to actual people on the ground doing the work. We always think people closer to the work can help you solve the problem faster than people further from the work. So that's always our approach. So thank you again. We appreciate you taking the time. And that's it. Unlearn Unlimited podcast. We'll see everybody next week. Please make sure Please make sure you share, like, and subscribe to support our channel. All right. Have a good one.
Yo,
Thanks.
for the noobs.
Yo.
Unlearning Unlimited. Unlearning Unlimited. Yeah.